Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Iloperidone. Its brand name is Fanapt. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now the exact mechanism of action of Iloperidone is not completely understood. However, it's thought that its mechanism is due to its effects on its antagonism of dopamine D2 receptors and serotonin 5-HT2 receptors. In terms of indications for use, iloperidone is indicated to be used in the treatment of schizophrenia. Now, before somebody was to use iloperidone, there is a contraindication they must clear, which in this case would just be a hypersensitivity to iloperidone or any other component of the product. And there's also some precautions and warnings that they should be made aware of. Now, in terms of precautions, iloperidone is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. Now, in patients with dementia, antipsychotics may increase the risk of a cerebrovascular accident, and mortality may increase as well, so we wouldn't want to use this medication to treat the elderly population who has dementia or delirium. Patients should be made aware that QT prolongation has occurred with the use of this medication, and that discontinuation is warranted if QTC is consistently above 500 milliseconds. We would want to avoid, if possible, in patients who have a history of cardiac arrhythmias, we would want to try to avoid the use of this medication in patients who have serious cardiovascular illnesses or a history of serious cardiovascular illnesses, such as patients in the acute recovery phase after a myocardial infarction or heart attack, as well as patients with uncompensated heart failure. Orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position, has occurred, and syncope or fainting has occurred as well. Because of the risk of QT prolongation, we would want to avoid using this medication with other medications that can also cause QT prolongation. Metabolic changes, including hyperglycemia or diabetic ketoacidosis, has occurred. Dyslipidemias and an increase in body weight have occurred as well. Patients with diabetes or risk factors for diabetes, such as a family history or increased body weight or obesity, and who use this medication may put themselves at an increased risk of experiencing hyperglycemia or high blood sugar. Some patients who use iloperidone may notice that they lose their ability to control their core body temperature. So they should use the medication cautiously when performing strenuous exercise, when exposed to heat, or if they are dehydrated. Patients who use iloperidone who have electrolyte imbalances, such as hypokalemia, would put themselves at an increased risk of experiencing QT prolongation. They would be at an increased risk of arrhythmias as well. Hyperprolactinemia may occur, and this could result in galactorrhea, amenorrhea, gynecomastia, impotence, hypogonadism, or a decrease in bone density. Patients should be made aware that esophageal dysmotility may occur, which could lead to aspiration, and in some cases could lead to aspiration pneumonia. Agranulocytosis, leukopenia, as well as neutropenia has been reported with the use of antipsychotics, such as iloperidone. Potentially life-threatening neuroleptic malignant syndrome has been reported, and the medication should be discontinued at the first sign of this developing. Seizures have been reported with the use of iloperidone and other antipsychotics, and the risk would be increased if patients are also using other medications that can lower the seizure threshold. Potentially irreversible tardive dyskinesias have been reported. They are more commonly reported in the elderly population and in women. Cognitive and motor impairment may occur, so this could put patients at an increased risk of losing their ability to perform hazardous tasks safely, such as operating heavy machinery or driving an automobile. And lastly, male patients should be made aware that priapism, or an erection lasting longer than 4 hours, has occurred, and in some cases, surgical intervention was required. Now, once somebody is cleared of that one contraindication and made aware of the precautions and warnings, and they start to use iloperidone, or Fanapt, they can expect to receive their dose in tablet form. So when somebody is using iloperidone to treat their schizophrenia, they would typically start off with an initial dose of 1 milligram twice daily, followed by a slow titration upwards. The dose would be increased by no more than 4 milligrams daily until a dose of 6 to 12 milligrams twice daily is achieved. The maximum dose of iloperidone is 12 milligrams twice daily. If somebody discontinues the medication for more than 3 days, they would start back off on the initial dose and slowly increase the dose again by no more than 4 milligrams daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using iloperidone, so I'll go over some of those here now. About 3 to 5% of patients experience that orthostatic hypotension that we touched on. Tachycardia, or a rapid heart rate, is seen in 3 to 12% of patients. Abnormal weight gain can happen between 1 and 9% of the time. Hyperprolactinemia happens about 26% of the time. 8 to 10% of patients may experience xerostoma. Dizziness can happen between 10 and 20% of the time. And somnolence comes in at a frequency of 9 to 16%. 5 to 8% of patients experience nasal congestion. And 4 to 6% experience fatigue. Now, some more rare but serious side effects would be hyperglycemia, a cerebrovascular accident, transient ischemic attack, or neuroleptic malignant syndrome. That's all we're going to talk about today with iloperidone, or Fanapt. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out below. That's it for today. Take care.